Triad of coagulopathy, acidosis, hypothermia, physiological exhaustion. Deadly triad, lethal triad, of trauma, hypothermia, acidosis, coagulopathy. Mycetoma, pathognomic feature, painless subcutaneous mass, multiple sinuses, seropurulent discharge. General anesthesia is commonly described as the triad of unconsciousness, analgesia, muscle relaxation. Cushing's triad, head injury, hypertension, bradycardia, irregular respiration. Normal pressure hydrocephalus, gait disturbance, incontinence, cognitive decline. Mass lesion brain, ICSOL. Focal deficits, seizures, raised ICP. Meniere's disease, intermittent attacks of vertigo, fluctuating sensorineural hearing loss, tinnitus. Whipple's triad, insulinoma, symptoms of hypoglycemia after fasting or exercise, plasma glucose levels less than 2.8 mmol/L. Relief of symptoms on intravenous administration of glucose. MEN1, Wermer syndrome. Tumor in the anterior pituitary gland. Hyperplasia of the parathyroids. Pancreaticoduodenal endocrine tumors. Ruptured abdominal aortic aneurysm. Severe abdominal and/or back pain. Hypotension. Pulsatile abdominal mass. GERD. Retrosternal burning pain, heartburn. Epigastric pain. Regurgitation. Charcot's triad, cholangitis. Upper quadrant pain, jaundice, fever. Reynolds pentad, Charcot triad plus, hypotension and mental status changes, both evidence of shock. Wrigler's triad, radiological sign of gallstone ileus. Small bowel obstruction, pneumobilia, an atypical mineral shadow on radiographs of the abdomen. Reiter's disease, urethritis or diarrhea, conjunctivitis and polyarthritis. Enterocutaneous fistulas, sepsis, fluid and electrolyte imbalance, malnutrition. Virchow triad, endothelial injury, venous stasis, hypercoagulable state. Graves' disease. Signs and symptoms of thyrotoxicosis. Goiter. Exophthalmos. Pheochromocytoma. Headache. Diaphoresis. Palpitations. Achalasia. Dysphagia. Regurgitation. Weight loss. Hemobila. Upper git hemorrhage. Right upper quadrant pain. Jaundice. Zollinger-Ellison syndrome. Gastric acid hypersecretion, severe PUD. And non-beta-islet cell. Tumors of the pancreas. Carney triad. Gastric gastrointestinal stromal tumor. Pulmonochondroma. Extraadrenal paraganglioma. Burkhardt triad. Gastric volvulus. Sudden onset of constant and severe upper abdominal pain. Recurrent retching with production of little vomitus. Inability to pass a nasogastric tube. Crohn's disease. Abdominal pain. Diarrhea. Weight loss. Portal triad. Portal vein. Hepatic artery. And bile duct. Choldical cyst. Jaundice. A palpable right upper quadrant mass. Abdominal pain. Intestinal obstruction. Abdominal pain. Vomiting. Obstipation. Urethral injury. Blood at the urethral meatus. Inability to void. A palpably distended bladder. Renal cell carcinoma, classic less than 10%. Flank pain. Gross hematuria. And palpable abdominal mass. Beck's triad. Cardiac tamponade. Hypotension. Muffled heart tones. Neck vein distension. Auscultatory triad of mitral stenosis. Increased first heart sound. Opening snap. Apical diastolic rumble. Small bowel obstruction, X-ray abdomen. Dilated small bowel loops greater than 3 cm. Air fluid levels seen on upright films. Paucity of air in the colon. Feltes syndrome. Rheumatoid arthritis. Splenomegaly. Neutropenia. Prune belly syndrome, also known as Eagle-Barrett syndrome and the triad syndrome. Extremely lax lower abdominal musculature. Dilated urinary tract including the bladder. Bilateral undescended testes. Terrible triad. An elbow dislocation. A radial head fracture. Coronoid fracture. Unhappy triad. O'Donoghue's triad. MCL. Medial meniscus. ACL injury.